Okay, so these are microcurrent probes. They basically are kind of like acupuncture without needles, just using you won't even feel anything because it's very, very low electrical impulses. So now for circling the dragon, I'm just going to do my searching and treating. So let's just go around. These are the eyes and the knee. I'm going to go to the bladder 40 point on the back of his knee and then go right through. So what's also useful is going from GB34, which is right below and in front of this fibular head, and spleen 9, which is this inner curve of the femur inside. Let's do the same on your other knee now. Okay, so what I'd like to do is ask you to just take a little walk again. Just walk up and down and just notice if there's any change whatsoever in how your knees feel.
Walking faster.
A lot of the stiffness is...
Everyone just speak in here, please.
A lot of the stiffness is related to
Okay.
the feeling of my knees being locked. I don't have that feeling right now.
Okay.
Yeah.
Very good.
Okay.
So what do you still feel?
Still have general pain, but it's less than it was before.
Okay.
Yeah.
So what I want to try to quantify, let's say if when you came in here, the amount of pain and stiffness you had was a 10, and 0 was total relief like you were 40 years ago or something. What would you say it's at now? What percentage of reduction of discomfort would you say you've had so far?
Just a second, I'll tell you. I would say 50%.
Okay.
Because I couldn't do that without pain before.
Okay, good.
Yeah.
Okay, why don't you have a seat? Let's see where we can go from there. That's step one. It's only step one of the sequence, okay? 50%. So now, let's see, how do we go beyond 50%? Well, I think we actually, because, can I ask you your age, please? 81, okay. Well, because you're 81 years old and because you've been teaching for 59 years, I think we need to do a root treatment. Just if all I do is, if I do the most skilled symptomatic treatment in the world, he'll get benefit, but it'll be, more temporary. So this is where you have to do root and branch. So, this is a common pattern in Japanese diagnosis: liver weak and lower left quadrant weak. So that diagonal dysfunction. So that's enough. That's all. I don't even need to test every point. So I know we want to do something about that. So I'm going to do the polar meridian pair, liver and small intestine. We're going to do all the polar meridian pairs on this side. And since we're dealing mainly with liver, I'm just going to leave it on green. It seems to be doing a good job. Here. So this is SI8 here, negative, SI3 positive. Take some deep breaths again. Keep those shoes on, please. So put the positive on here, and the negative down here. So liver 2 has the negative, and liver 8 has the positive. This is the root treatment part. Whoa! My wolf totem is coming up. Okay, try it one more time. Yeah, that way. See what.
Just the imbalance of.
Yeah.
Yeah, that's better. Yeah.
So is it?
Yeah.
How would you compare it to the first walk after the first technique?
A little better.
A little bit more better. Okay.
Yeah.
Okay, so the next thing we're going to do is do some polarized local distal techniques.
Okay.
Let's get on the knees.
On the knee?
Yeah. Or the outer part?
Right there.
Right there, okay. Why don't you hold this for me right there?
Sure.
Is it both knees hurting or just that one now?
Just that one, basically.
Oh, just that one, okay. So I'm having the patient hold the positive for me. And I'm going to go up here to this sensitive point. This is a knee reflex point. Where's that tender point?
You haven't found. There it is. Oh, there it is.
Ashi. Okay, take some deep breaths. The reason I'm doing it this side is this is the side that's tender. Better after the first technique. Or just what percentage better are you now? Hold the microphone up.
Another 10% probably.
Another 10%, okay.
Could you try LI11 opposite side, Darren?
LI11? You can try that. Sure. Now, one thing here's another real secret about this is complementary colors. Is that I usually use at least 2 colors in each treatment, and they're complementary. So we've already used green, so we got to use some red now. Now usually when I just muscle test, without even trying to, it always comes out that way. But I'm going to go ahead and take the green out and use some red, because red is the most complementary color to green. Okay, now we have red light. Okay, so we're going to go ahead and put this. Where's the remaining areas of that few percentage of pain left?
I'll see if I can find it now.
Another thing you got to remember, there's a delayed action with this, so I wouldn't be surprised if you might feel better tomorrow, right now, but we're going to see as much as we can get right. Okay, right under the fibular head.
Yeah.
Okay, now I'm going to go to LI11 over here on the opposite side. This is with red light now. Take some deep breaths. There's no pain on this knee anymore?
No.
Okay.
Not a little bit.
Okay.
Minor.
And the last thing I want to do is here, hold this on the painful point for me a little bit, please. To go to the general knee area of his ear. This is auricular micro-macro technique.
Are you on the knee point?
Yes, approximately. Of course, I'm covering a few points because it's a Q-tip. Okay, take one more walk and let's see how you're doing with that. Same, better, or worse?
I can go play.
Tell them how you do it.
The pain is, I would say, 90% gone, and I can enjoy playing again.
Wow, that's wonderful.
All right, thank you for volunteering. Okay, next.
Maxine?